could you maybe tell us a bit about your cancer diagnosis and treatment and how you're doing at the moment?
Of course. So I had a primary diagnosis at the age of 37, 11 years ago, so you can do the math. And I had a 4-year-old and a 1-year-old who I was still breastfeeding. And so the diagnosis was passed off as pregnancy-related issues that I was having. I went through a whole journey there: chemotherapy, surgeries, radiotherapy, etc.
And so that was breast cancer you had, Lynne? Yeah.
Breast cancer, yes. And then I have gone through the last 11 years never being off treatment. So there's always been something that I've been, an operation I'm preparing for or recovering for, a systemic treatment, etc. And then in 2018, I hurt my hip just coming out the shower, didn't think anything about it. And at A&E, they discovered that my breast cancer had gone to secondary incurable breast cancer at that point in my bones. So I've lived since 2018 now with the knowledge that I will not get better. This is incurable. This is long-term systemic treatment. So it's not a case of working with some chemotherapy and then I go back to work and life goes back to normal. This is my life and I've had to get used to that. And so since then I've had different treatments. Treatments work for different people for different lengths of time. Some work very well for individuals and don't work well for others. Some you feel well enough on, some of them you really don't. And I think we'll come to some of the challenges that but that's where I am now. I do have further progression. I'm actually off work as I speak to you at the moment, just recuperating from an operation. So, but I have worked for 3.5 years at, a senior level, and it's
amazing.
So yeah, so you can. I think it's one of these things that it changes all the time, and it's just about working with the individual.